Hey guys, Dr. Joseph Bogart here, chiropractor in Parkland, Florida. I'm here to show you how to use these fabulous WEI patches and what they are. Quick backstory. These are a combination of various herbs designed to bring blood flow and nutrients to damaged tissue, as well as stimulate the removal of metabolic waste to speed up healing, break down scar tissue, break down fibrous adhesions, things of that nature. There's different patches. There's a Fastt patch, which is used for usually acute damage to ligaments, muscles, tendons, even bone fractures. There is a Whitee patch, which is used for more chronic issues where there's scar tissue. If you need to build up cartilage for things like discs or knees, meniscus, labrums, into various parts, this is what you're going to want to use more of. Sometimes we use a combination of Fastt and Whitee. If you were prescribed a combination of Fastt and Whitee, alternate them. First a Fastt, then a Whitee, then a Fastt, then a Whitee, okay? If you are prescribed a gold patch, this is usually for something related to more of a fluid-filled or a cyst type issue like a lipoma or a ganglionic cyst. I'm going to read down a quick list of things that these patches can help. Let's talk about the Fastt patch. The Fastt patch is known for more acute issues and things such as, if you're ready, muscle and ligament injuries, sprains, strains, partial tears of things, plantar fasciitis, AC joint separations, bone fractures, stress fractures, hip fractures, as well as tendon issues, tendinopathy, tendonitis, carpal tunnel syndrome, even rotator cuff issues, tennis elbow and Achilles tendon issues, bursitis, and even the TMJ. Now that's the Fastt patch. Let's talk a little bit about the Whitee patch. Here are some symptoms and complaints that it can help with. Osteoarthritis, so arthritic edges, bulging or herniated discs, spinal stenosis, bone spurring, bone-on-bone conditions like if your knee or your shoulder, rheumatoid issues, gouty issues, Baker cyst issues, which are a result of usually knee issues or knee injuries, pinched nerve issues, torn meniscus, cartilage injuries, growth plate injuries, facet syndromes, bunions, Morton neuromas, scars, and degenerative disc diseases, to name a few. So these products, like I said, I've been using them for a very long time. They are amazing and do a great deal of things to and for the body in a healthy way. All right, we're going to talk about the Fastt patch, but this can be applied to both the Whitee patch or the gold patch, but we're going to use it in this example as a Fastt patch. You're going to be given a series of Fastt patches or Whitee patches or alternation, and they are to be worn for 48 hours at a time. So when you open this packet, you will see let's open one. Inside here, you will see this. This is a self-adhesive, and I'm going to peel this back for you. You can see where that black tarry sticky stuff is here. That's where the herbs are. This other non-latex material is just for adhesion, but it's the black, gooey, smelly, stinky stuff that does the magic and get the tissue to heal. So what you would do is you would peel this off and apply it to the area that was damaged. If it was my hand, I would put it on my hand. If it was on my shoulder, where my shoulder damage is, I would apply it directly to the skin, which has already been cleaned, hopefully with soap and water or alcohol, but you do not want lotions, oils, or sticky, gooey, slimy, other things, because this won't adhere as well. If need be, you can use things like rock tape, kinesio tape, or athletic tape to hold this onto a specific area. Sometimes they tend to move or peel. So let's talk about what to do while you're wearing the patch. While you're wearing the patch, you can do anything that's comfortable, as long as you're not making it worse by causing pain if a certain position of movement. Don't do that. You can shower, you can swim, you can sleep, you can exercise and do things with this. However, by day 1 or 2, sometimes the corners of this will start to peel up, in which case you want to tape that down. If you are sleeping with this on, say, a shoulder, you may want to wear a junky t-shirt, which will keep this from peeling off and getting onto your sheets. If it's on, say, your ankle, you may want to wear a sock to keep it from, again, peeling off onto your sheets or your clothing. While these are on, let's talk about while they're on. It is very advisable to use heat. I know a lot of people think ice is really good for acute situations, but if you're using a Fastt patch and I have, let's say I acutely tore something in my shoulder, I would peel this off, stick it on my shoulder, and while it's on, apply heat. The heat actually pushes it further into the tissue, and it also helps to stimulate more of the vasodilation, which brings this stuff in and gets it to heal even faster. So we're at the let's pretend we're at the 48-hour mark, and it's time to take this off. How do we do it? Well, you can peel it off, take it off. It may leave some black, tarry, gooey, residual residue. If that's the case, some type of an oil will get it off, like olive oil, mineral oil, baby oil. Any type of oil will emulsify and break down that the herbs that are on there. However, a little trick that has been taught to me is that while this patch is on, if you were to take a cold pack, let's say an ice pack, put it on here for about 60 seconds and then remove it, that cold actually makes it all harden and stick to itself better, so that when you peel it off, there's little or no residue. That's a tip on taking that off. So you're gonna do this in a series where you're gonna wear each patch for 48 hours, take it off, leave everything off for a day, then put a new patch on for 48 hours, take it off for a day, put a new patch on, and so and so. The reason they give you a day in between is so that your skin doesn't get irritated by cutting off oxygen and to the air. It actually allows to let the tissue air out. However, if it's in a place that doesn't necessarily need, like a non-sensitive area of skin, like let's say your kneecap, you can just put one on, then the next day, and the next day. But the real rule of thumb is just put one on every 48 hours with 24 hours in between, okay? So that's how you use the Fastt patch, the Whitee patch, and the gold patch. I'm gonna put some links in the description below on what they're made out of, how they work, etc. Read them, enjoy them if you want. Oftentimes too, depending on your situation, I will include LC Balancer. LC Balancer stimulates microcirculation, kidney elimination to get your circulation flowing, which actually makes this work even better. Sometimes I will use a product called Brown, which actually helps with breaking down arthritic issues if it's in the spine, let's say, or in other parts of the body like the shoulder or the knee or hips where there's a lot of arthritis. The Brown helps to break down that arthritic change. So you may want to take those oral supplements in addition to this if it was prescribed that way by your doctor. If in the event you happen to get some of this tarry sticky goo onto your clothing or your bed sheets, the only way you're going to get that off is with a product called Oxypower. You're going to want to take it, rub it in, possibly use a brush or a toothbrush, let it soak, and that will actually emulsify and get this out of clothing or sheets. They are fantastic. All right, thanks so much. Bye-bye. Certain I will include certain oral remedies to go with